OK, we're going to get more reaction now to the government's plans for dealing with COVID this winter, plans A and B. I'm joined now by the Conservative MP, Dean Russell, who's a member of the Health and Social Care Committee. Very good to talk to you, Mr Russell. And so we've got the issue of potentially bringing back mask wearing, working from home, social distancing, things like that. I suppose the point is none of us know, right down from the Prime Minister and his medical and scientific advisors, if they'll be needed and if they are, whether they'll work.
Well, I think the most important thing is that we've got to build upon the successes we've had so far. You know, you look at the vaccine programme, you look at the incredible work of the public in terms of following guidance, and also of the amazing NHS and social care staff in delivering an incredible amount of work over the past year and a half. And so we want to build on that, but we also have to be really, really aware that COVID's still there. I believe there's still about 6 million adults who haven't had the jabs. 81%, I believe, have had 2 jabs, which is incredible. So we need to build on that, but also be aware that COVID, throughout the past year and a half, does take sharp turns. And so I think it's right that we look forward and have in our back pocket, as it were, a plan B for issues that we can't foresee yet.
It's on those sharp turns, though, that I want to ask you about, because you'll have heard the Chief Scientific Advisor, Patrick Vallance, saying that this time round on the use of these measures, go early and go hard. No shilly-shallying around like the first lockdown.
Well, true, but I think we're in a different place now as well. And, you know, of course, the scientific advisors, there's Patrick Vallance, Chris Whitty, have been amazing over the past year and a half in terms of advising and giving government the best advice that we can get. But we also need to make sure that we're taking into the bigger picture around impacts on education, on jobs, on livelihoods, on mental health, all of those things. So it's so important that when we're following that guidance, we look at that in the round, and, you know, politicians need to make those decisions. But I know from my expectations within the chamber today, from listening to the Secretary of State, you know, there's no wish to have to go back into lockdown. There's no wish to have to put this plan B into place. But I think it's important that we have it there just in case things do go badly wrong. But I don't.
So, I mean, you know, lockdown ultimately is plan C then. I mean, it's not ruled out altogether. No one wants to do it. But if necessary, 4th lockdown.
I don't foresee that happening. I think we're in a totally different place than we were even a few months ago. And so when we look at where we're at with the number of people that are vaccinated, we look at the way society has adapted, we're in a much, much better place. So I can't foresee that. Of course, politicians should never predict anything, but I think when we look at where we are, it's a totally different game than it was a year ago. And as a member of the Health and Social Care Select Committee, we've looked at each turn of this awful past year and a half of the pandemic, and we've learnt a lot as well, I would say, both as a society, as government, as individuals. And I think those learnings are going to be really powerful as we come out of this and ease out of this in a safe way, but hopefully in a permanent way, so that we can get our livelihoods and our lives back on track.
Yeah, and there's a big question, isn't there, that the public, everyone wants to know, is, you know, what would be the triggers for bringing back in certain restrictions? What levels of infections, what levels of hospital admissions, and what levels of deaths? We haven't got that clear, have we?
Well, I think what we found is that when COVID changes, you never quite know what it's going to adapt to in terms of the variants. You know, when we found the Kent variant last year, it was a very, we didn't know the variant was going to come, and then it came and it had a rapid impact. That was before the vaccines were there. And over the past year and a half, it's mutated quite a lot in terms of the different variants. So what we need to be sure of is monitor, track. We've got such more sophisticated testing in place now, the ability to identify new variants much more quickly. We've got all of the different measures in place to be able to manage this, which we didn't have a year ago. So the measures are there, and it's about tracking those sensibly, cautiously, but also making sure that we look towards our freedoms moving forward to increase those as best we can in a safe way.
Mr Russell, great talking to you. Thank you very much indeed for joining us on Sky News tonight. Dean Russell there from the Health and Social Care Committee.